This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon. Thank you for joining us today for our HealthyU webinar series. Today's topic is navigating Medicare. Please enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted towards the end of the presentation. I'd like to introduce you to today's presenter, Lynn Ellenson. Lynn Ellenson is a volunteer for HiCap, the Health Insurance Information, Counseling, and Assistance Program. She provides one-on-one counseling on Medicare at various libraries in Suffolk County and senior centers, and also gives presentations on Medicare basics. Lynn is a retired healthcare professional in policy analysis and health services.
Should I get started? I think I should.
Please do.
Okay. Hello, everybody. First of all, I want to thank Mather Hospital for inviting me here, and also for all of you for attending this presentation. Next slide, please. So as Christine said, I am a volunteer for HiCap. This is a federally funded program. It's found in many states, and every state actually has some sort of program to help people to navigate Medicare. And in New York State, we happen to have HiCap. In Suffolk County, HiCap is administered by the New York State Office for the Aging through the Retired Senior Volunteer Program, or RSVP, of Suffolk. And what we try and do is provide unbiased information about Medicare and Medicare-related health insurance and financial assistance. And we do this through volunteers like myself. We do not, we try and give you advice and all of the information that you need to make a decision on how you want to receive Medicare and the different health plans that you might select. But we give you enough information so you can make those decisions yourself. Okay, next slide. So if you've read anything about Medicare so far, you know that it is fairly complicated. And so I'm going to try and give you an overview. I can't give you all of the details. It would take a really long time, but I'll try and talk for about half hour to 40 minutes. And then, you know, make sure that we can answer all of your questions either today or later on. We can send your answers. But I want to talk about the history of Medicare and what it is and how it works. And then there are different parts of Medicare that I will go through to tell you what each part does. And then there are different times of the year when you can enroll in Medicare. So we'll talk about that and how you can change your plans if you want to make changes. And then you'll see that there are some costs to Medicare. So there are a number of programs that can help you to pay for Medicare. And then because we can't possibly go through everything, I'll give you some websites and some phone numbers and places that you can go for help and further advice. And then of course we'll have some questions. Next slide. So first, the history of Medicare, just very briefly. Next slide. Even as back as 1935, the Social Security Act was enacted, and there was a health care part to it, but it was so controversial that FDR actually took it out of the Social Security Act of 1935. And so it wasn't until 30 years later that we actually got Medicare and Medicaid signed into law during Lyndon B. Johnson's administration. And Medicare and Medicaid were actually amendments to the Social Security Act of 1935. And what it contained was actually what's called original Medicare. Part A, which is your coverage for hospitalization, and Part B for outpatient or doctor's visits. In 1972, Medicare was actually expanded so that besides being open to people over the age of 65 and over, people with disabilities who had had their disability for a certain amount of time were able to apply for Medicare. And then in 2003, during the Bush administration, gotta go back. We had a further expansion of Medicare with Part D drug plans. These are all private drug plans that you would be able to purchase, but it gives coverage for drugs that you may be taking. And then finally in 2010, although the Affordable Care Act is mostly for people under the age of 65, there are a couple of sections in the Affordable Care Act that are related to Medicare. You are now able to get preventive services with no copays, and there's something called the donut hole, which has to do with how you would pay for your drugs in your drug plan that has gotten reduced over time. So these were added during the Obama administration. Okay, next slide. So let's just talk about what is Medicare and how does it work. It's a federal program. It provides health insurance for people who are age 65 and over, and also for those who are under age 65 who are receiving Social Security Disability Insurance, or SSDI, for a certain amount of time. And usually it's 24 months. So after 24 months, people who are receiving benefits under the Social Security Disability Insurance Program will be eligible to apply for Medicare. Those under 65 with kidney failure requiring dialysis or transplant are also eligible for Medicare. Next slide. So the parts of Medicare, I talked about Part A and Part B, which are original Medicare. Your prescription drug benefit is Part D, and those are the major benefits, the major parts of Medicare. Part C is also considered to be Medicare. These are Medicare Advantage plans. A Medicare Advantage plan is basically, it's a combination, it's almost like one-stop shopping. And it's a combination of Part A, Part B, and Part D if you want it. And these plans are administered by private insurance companies, and they contract with the federal government. They contract with Medicare. So Medicare pays these plans, these companies, to provide Medicare benefits. So if you have a Medicare Advantage plan, you're still considered to be on Medicare, even though the plan is a private plan. Okay. Next one. So when you're signing up for Medicare, you have a couple of choices that you have to make on how you want to be covered. First, you need to decide whether you want to have original Medicare or Medicare Advantage. So if we talk about original Medicare first, as I said, that consists of Part A and Part B. It does not consist of drug coverage. So if you are being covered by original Medicare, then you are going to probably want to purchase a standalone prescription drug plan. That now, after you've done that, you also have the option of purchasing a standalone Medicare supplement. And the supplement is also private insurance, and it's also called Medigap, and it helps to fill in the gaps for some of the costs that Medicare charges. Now, let's say that you want to get your Medicare through a private Medicare Advantage plan. And remember, that consists of Part A and Part B, and you have the option of choosing a plan that also has a Part D or a drug plan. And so you do not have to take a drug plan if in fact you're covered, your drugs are covered in another way. For example, if you are a veteran, you may want to use the drug plan that the VA has. So you do not have to get a Part D prescription drug plan. If you do, then it's included in your Medicare Advantage plan. If you take Medicare Advantage, then you do not buy a supplement. And in fact, health insurance companies are by law not allowed to sell you a supplement. So with Medicare Advantage, you have Part A, Part B, and possibly Part D. Okay, next slide. So how do you make a choice? Original Medicare is the traditional program administered by the federal government. And this is probably the key piece of information that that really helps people decide about original Medicare. It is accepted by most doctors and hospitals in the United States. It does not have a drug plan, so you need to purchase a separate drug plan if you're on original Medicare. And then you are also open to purchasing a Medigap or supplemental insurance to help you to pay for your out-of-pocket costs. So with original Medicare, you're kind of juggling 4 different things in a sense. With Medicare Advantage, as I said before, it's like one-stop shopping, and you still have Medicare benefits. It's just that they're offered in a slightly different way by a private insurance company. And the thing that I think helps people to decide one way or another for Medicare Advantage is that you are often limited to doctors and hospitals that are in the network. For some Medicare Advantage plans, you can go out of network, but if you do, then you're going to have much higher co-pays. And for some plans, if you go out of network, then you're not covered at all by those doctors and hospitals. But you usually can get a drug plan from the Medicare Advantage plan. And Medicare Advantage plans, a lot of people see this as a real upside, also offer certain benefits that original Medicare doesn't offer, like hearing, vision, and dental. Okay, next one. Medicare Part D, as I mentioned, is your outpatient prescription drug benefit for anyone who has Medicare. It's only available through private and insurance companies, and you can get it in 2 ways. You can get it as a standalone if you're under original Medicare, or if you have a Medicare Advantage plan. And it has monthly premiums, and many of these plans have a deductible. So I want to show you all of the plans that would be open to you. We have the next slide. I think you can read it. I tried to make this as big as possible, but it also can be sent to you if you request it. So you can see, let's see if I can get to this. There we go. So you can see in this column, these are the monthly premiums, and we'll have some more on the next slide. But the least expensive one is $13.20. But then there's one for $91.20. I think I covered it. But that one actually has no deductible. Some of them have deductibles as high as $435, which means that you would have to pay for your drugs out of pocket up to $435 before your plan would start covering you. Have the next slide. So here are the rest of the plans, the drug plans, with their phone numbers. And one thing you want to do before you decide to get a drug plan is make sure that the drugs that you're taking are in the formulary of the particular drug plan that you choose. So you can call the drug plan, and we've given you the numbers. But another way to decide which drug plan might be the best for you is to go onto the Medicare website, www.medicare.gov. And there's a tab there that helps you to find health plans, drug plans, and you would enter all of the drugs that you're taking. And then the website would tell you what your costs would be for that year, whether you whether those drugs are covered, and you'd be able to see which would be the most costly plan for you based on the drugs that you're taking, and which would be the least costly. So we can help you at HiCap. I'll give you the number at the end. If you need some help going through the website, it's actually a really useful way to try and decide which Medicare Part D standalone plan you want to choose. Okay, next one, next slide. So there are costs to Medicare. Part A is free to most people. As you've been working, you've been paying into the fund that covers Part A, that's your payroll tax. And so if you've been working 10 years or more, or your spouse has been working 10 years or more, then Part A is free to you. If you have to pay for Part A, it could cost you as much as $458 a month if your work history is limited, although there are some programs that would help you to pay for that. Now, if you were to go into a hospital, you would have to pay a deductible of about $1,400 for each benefit period. A benefit period begins the day that you're admitted to the hospital as an inpatient, and it ends if you haven't gotten any inpatient hospital care or skilled nursing facility care for 60 days in a row. So if you were to go into the hospital in April, and then you went into the hospital again, let's say in November, in April you would have to pay your $1,400 deductible, but if you went into the hospital again in November, you would have another benefit period and you would have to pay the deductible again. Now this would get taken care of. This is what some of the supplements will pay for. And also they will pay for more than 60 days of staying in the hospital. Your first 60 days are free, but then there are costs beyond that. Supplements will pay those costs, and as well as the deductible. In a skilled nursing facility, your first 20 days are free, but then it costs you $176 per day for up to 100 days, 21 through 100 days. But your supplement would pay for that. There is a premium, a Part B premium that everyone needs to pay each month. It's $144.60, and if your income is higher, it would be higher than that. So if your income is $87,000 as a single person, or $174,000 for a couple, then your premium would be higher. For people who are on Social Security, that premium just automatically comes out of your Social Security check. And so a lot of people don't even realize that they're paying a premium, but that premium is every month. And then there's also a Part B deductible of $198 a year, which means that your Part B coverage doesn't really kick in until you've paid out of pocket $198. There's also coinsurance for Part B, which means that, and I think you see this on TV a lot, for the advertisements of various health plans, but Medicare will pay 80% of the approved amount of a particular service, and you will have to pay 20%. Again, this gets covered if you have a supplement. Part C also has a cost depending on your plan. There's a monthly premium, and then Part D, as you saw, had a monthly premium as well. Okay, next slide. Actually, I think I'll skip these two slides, but they can be made available to you. These would be the costs if your income is above $87,000 or $174,000 as a couple. So let's just go on to the next one and talk about Medigap, or supplemental insurance, which I mentioned is optional. It covers some or all of those co-pays that we just talked about, coinsurance and deductibles. The plans vary in what they cover. There are A plans and F plans and N plans. This is what makes it, not to be confused, A plan with Part A, and this is also what makes it very confusing. So let's go to the next slide so we can see what the different plans will cover. The F plan and the C plan, and the F plan is the most comprehensive. The F plan and the C plan are no longer being sold if you are new to Medicare. But if you were eligible for Medicare prior to January 1st, 2020, then you would be able to purchase an F plan and you would be able to purchase a C plan. The G plan is the next most comprehensive, and it covers everything that the F plan covered except for one thing. It doesn't cover that Part B annual deductible of $198. I also like people to look just for comparison at the N plan, which covers just about everything that's covered by the G plan, or the F plan even, or the C plan. One caveat is that every time you go to the doctor, you need to pay up to $20 for a doctor's visit. And what it does not cover, two things it doesn't cover. It doesn't cover your annual deductible of $198. But if you're new to Medicare, you can't buy any plan that will do that. And then the other thing is that it doesn't cover excess charge. It doesn't give you excess charge benefits. If your doctor is part of Medicare and subscribes to Medicare, then he or she is not going to be charging you excess charges. If your doctor is opting out of Medicare, then he or she can charge you up to 5% more than the approved amount that Medicare lays out. So the G plan will pay for those excess charges. If you have a doctor that doesn't charge you extra, then you really don't need to have that as part of your Medigap plan. So let's go to the next page, and we can look at the plans and what they cost. If we look at let's look at the G plan, and you can see that there are a number of companies that sell the G plan, actually. And you can see that they're all different prices. So if we look at Bankers Conseco, the price per month for a G plan is almost $600. Whereas if we look at Empire Blue Cross Blue Shield for a G plan, it's about half that amount. It's $270.14. So I'm not allowed to tell you which plan you should get, but I do want you to be aware of the fact that all G plans by law must contain the same benefits, must have the same benefits. And so a G plan from Empire Blue Cross Blue Shield is really going to be the same as a G plan from Bankers Conseco. Let's look at the N plan, and you can see that it's giving you a little bit less than the G plan. But if we look at the very least expensive of the G plans, the Empire Blue Cross Blue Shield, it's $192 compared to $270. So again, you need to decide how much coverage you want, and then decide which, so then first decide which of these plans you want, and then decide where you want to get it from, okay? You can go on the Medicare.gov website again, and you can look at all these plans and look at the details of these plans. You can't sign up for them online. You have to call the company to sign up, but you can get information, more specific information about each of these plans. Okay, next slide. Now, Part C, Medicare Advantage, remember it combines Part A, B, and D. Your services are provided by a private health insurance plan, and you still have Medicare. You must pay your Part B premium no matter whether you have original Medicare or Medicare Advantage. And the biggest difference between original Medicare and Medicare Advantage is that in Medicare Advantage, you're limited in the doctors you can see and the hospitals you can use. So that is the main difference, but a lot of people don't care about that. And they're happy to use Medicare Advantage. There's another difference, as you'll see, next slide. And that is, if you look at the monthly premiums, a number of them are a lot less than what you would have to pay if you were getting a supplement. So you can get a monthly premium for $93, $48. Some of them have no monthly premium at all. A number of them have drug plans attached to them. I think all but 2 or 3 on this list have drug plans. And so those drug plans will have a deductible just like the standalone plans. They all are providing you with extra benefits, dental, vision, and hearing as well. Can we go to the next slide? These are the same plans. I just wanted you to see the some of the co-pays that you would have to pay. A number of them have co-pays for going to, each time you go to a primary care physician, and also each time that you go to a specialist. The way it works if you go into the hospital is that a number of them charge you a certain amount for the first few days, and then after that, and it's almost like your deductible, and then after that, it's either free up to 90 days or free for the whole rest of the time that you're in the hospital. So these are all the plans that you have to choose from in Suffolk County. This will probably change next year, but for now, these are the plans. And again, you can go on www.medicare.gov and you can look at these plans. And I think it's really important to look at these plans and also to call the plans when you decide on 1 or 2. Make sure, if you care which doctors you're seeing, you want to keep the doctors that you have. You want to make sure that these plans, that your doctors, actually it's better for you to call your doctor and ask if they take a particular plan, because you want to make sure that you're going to be covered with whatever plan you choose. And the same thing goes for the drugs. You want to make sure that your drugs are covered in the particular plan that you choose as well. Okay, next slide. Okay, and just as a reminder, Medicare does not cover certain things. It doesn't cover dental care. This is at least original Medicare. It doesn't cover dental care, vision care, routine hearing care, doesn't cover hearing aids, most foot care, doesn't cover long-term care or alternative medicine. Most of the care that you receive outside of the US, unless you have a supplement, some of that will be covered. It doesn't cover personal care or custodial care if in fact there's no need for skilled nursing care. So it doesn't cover a person or an aide to help you or your parent to get to the bathroom. So that's not covered by Medicare. And it also doesn't cover most non-emergency transportation. And just remember that Medicare Advantage plans do cover some of these services. Okay, next slide. Okay, so you can only enroll in Medicare a few times during the year. So let's just talk about that. There are 4 ways to enroll in Medicare. There's automatic enrollment, initial enrollment, general enrollment, and special enrollment. Your automatic enrollment, next slide, is if you are 65 and you're receiving Social Security retirement benefits or railroad retirement benefits, you're going to automatically be enrolled in Medicare. Same is true if you are on a disability, SSDI, and you've been on that for 24 months, or you're on railroad disability, then you're going to receive your Medicare card automatically. And if you have been diagnosed with ALS or Lou Gehrig's disease, you're going to automatically be enrolled in Medicare the first month you receive SSDI. You don't have to wait for 24 months. Now you're automatically enrolled in Part A, but you're also automatically enrolled in Part B, but you're given the option of turning down Part B. And a lot of people do turn down Part B, especially if they are working or if their spouse is still working. For people over the age of 65, if they're working in employment that has more than 100 people, more than 100 employees, then they don't need to get their Part B. If they have Medicare and or they're eligible for Medicare and they have a disability, but they're still working actually, or their spouse is still working, and they're working in a employment that has more than, let's see, let me just check, more than 100 employees, then they don't have to get Part B. But you have to be very careful. If you turn down Part B, just make sure that your employer insurance is going to pay for your health insurance as a primary insurer. Otherwise, you need to get Part B. Okay, next slide. Now, your initial enrollment period is the time when you're starting to approach age 65. It's the 3 months before your birth month, and the 3 months after your birth month. So those are the months when you can apply for Medicare. You can first enroll. You should try and enroll before your birth month so you have no gap in coverage, and so your first coverage will begin on the first day of your birth month. Okay, next slide. There's also other enrollment periods, the special enrollment period and the general enrollment period. Special enrollment period, there are a number of circumstances that will give you a special enrollment period outside of your initial enrollment period. And one of the most common is if you retire from your job and you no longer have health insurance. So you can be age 70, decide to retire, and then you have 8 months from the time that you retire. A lot of people like to make sure that they set up Medicare so that the day that they require, they start their Medicare on the next day. But you want to make sure that you do sign up for Medicare, and that you also can, at that point, sign up for Part D and also get a supplement. Okay, there's a general enrollment period, January 1st through March 31st. And there you can sign up for Part B, but your coverage is going to begin in July. And it also means that you're going to incur a late enrollment penalty. So you really want to try and either sign up during your special enrollment period or your initial enrollment period. Okay, next slide. So you can enroll in Part D during your IEP. You can also make changes to your Part D during the fall enrollment period that we'll talk about in a second. And if you use the fall open enrollment to enroll initially for Part D, then here you're going to incur a premium penalty for Part D as well. Okay, next slide. Medicare Advantage, you can enroll in that during your IEP, your initial enrollment period, or if you qualify for a special enrollment period, you can enroll in your Part C Medicare Advantage as well. Okay, and you have to have Parts A and B in order to enroll in Medicare Advantage. Okay, next slide. And a supplement in New York State, you can enroll at any time. So if you decide you don't want to get a supplement right away when you're enrolling in Part A, B, and D, you don't need to. But a lot of people do try and get it all done at once. To find a plan, remember I said you can go on Medicare.gov to help you to find a Medicare supplement plan. And HiCap can also help you. You can call our helpline, and we can help you to go through the Medicare supplement plans. Okay. I do want to remind you that there are penalties if you don't sign up for Medicare during the times when you can. There's a late enrollment period for Part B if you don't sign up, if you sign up outside of your initial enrollment period or your special enrollment period. And there's also a Part D late enrollment period. Number of people don't realize that there's a penalty if they don't sign up for Part D. And so when they're first signing up for Medicare, they say, well, I don't take any drugs, so I'm not going to get a drug plan. However, when they start needing drugs and they want to sign up for a drug plan, they find that they're going to be penalized, and that penalty is going to be added to their premium, and it basically lasts for life. I had one woman who was over the age of 80, and she just, at that point, was signing up for her Part D drug plan, and so her penalty actually was costing her as much as the premium for her drug plan, unfortunately. And then, of course, I mentioned before, you are going to be paying higher premium costs for Part B and Part D if your income is $87,000 as a single person or higher, or $174,000 or more as a couple. Now, you can change your plans, but also there are different times of the year when you can do that. So October 15th through December 7th, actually coming up soon, is your fall open enrollment. And here's when you can make the most changes. You can change from original Medicare to Medicare Advantage. You can change from Medicare Advantage to original Medicare. If you have Medicare Advantage and you don't like your plan, or perhaps you need to include different doctors or different drugs, you can change your Medicare Advantage plan to a different one, and you can also change your Part D plan. All of that can happen during fall open enrollment, okay? There's something called Medicare Advantage open enrollment period. Here's where you can change your Medicare Advantage plans also. You can leave your plan, your Medicare Advantage plan, and you can switch to an original Medicare with or without Part D, but you cannot switch from original Medicare or to Medicare Advantage during this time period. And you can't change your standalone Part D plans. You have to know when you can make these changes. As I said, fall open enrollment is the time for you to be able to make the most changes. Next one. Finally, there's an SEP 65. If you decided to get Medicare Advantage when you were enrolling for the first time at age 65 during your initial enrollment period, then you actually have 12 months to change from Medicare Advantage to original Medicare. And at that time, you can also enroll in a Part D plan at the same time. And you can also buy a Medigap if you wanted, because in New York State, you can buy that at any time of the year. Okay, now we talked about the costs. There are a number of programs that help you to pay for the costs. You need to be eligible, income eligible for these programs. And I'm not going to go through all of them, but I will mention them here. And if you have questions later on or want to talk to somebody from HiCap about these programs, then we'd be happy to talk to you. There's something called the Medicare Savings Programs. They help you with paying for your premiums, your co-pays, your coinsurance, and they're called Medicare Savings Programs, but they're actually, you would sign up for them through Medicaid, through the Medicaid office in your state or in our county. There's another program called Extra Help, which helps you with your drug costs. That actually is something that you would sign up for through the Social Security Administration. And then there's something called EPIC, which is only for people over the age of 65. People with a disability who are on Medicare can't use this program. It's a very nice program that helps you with your drug costs, and it also gives you a special enrollment period at least once a year, so that if you change your drugs, then you can get a new drug plan. And then finally, Medicaid helps you to pay for a lot of the things. First of all, it gives you many things that Medicare doesn't cover, but also helps you to pay for your Medicare costs. Again, I'm not going to go into all of the details, but if you have questions, we can come back to this, or you can call the helpline. Okay, so let's go down to the bottom where, keep going. Next one. Just want to show you some of the phone numbers and websites where you can go to for help. Medicare is always a really good place to go. I'd actually start with their website and search in their website for something, or even Google it, and the Medicare website will often come up. Telephoning them is also very good. Just going down to toward the bottom, our HICAP helpline. You can call us. Typically, we do one-on-one counseling at libraries, but you can call the library that you usually go to, and they can set you up with a counselor that can provide you with, for now, advice over the telephone. But you can call the HICAP helpline. We can try and answer your questions on the helpline, or we can set you up with a counselor to talk to by telephone during this pandemic. There's something called the Medicare Rights Center, and that's actually an excellent resource that we as counselors go to, but there's a special telephone number that you can go to get one-on-one advice as well. And they also have a website, Medicare Interactive website, that you would want to go to you can just basically key in your questions, and that'll come up. So right now, let me open this up to questions. We'll see if you have some, and I'll try and answer them. If we can't, we'll get back to you, make sure that we can answer them.
Thank you, Lynn, for your extremely informative presentations. If anyone has any questions, you may enter them in the Q&A feature on the bottom of your screen. So first question, I have an Aetna Advantage Group PPO, which is not accepted at Stony Brook Hospital, and it's credited doctors. Can I just use the Medicare that I'm paying for out of my Social Security?
Well, the Medicare that you're paying for out of your Social Security is basically your Part B. And so if you have a Medicare Advantage plan and Stony Brook is not taking it, you would want to, I think, try and change to Medicare Advantage. If you do that, then you would want to get a Part D and possibly a supplement. But if your plan is not if Stony Brook's not accepting your plan, then pretty much your costs are going to be out of pocket.
Next question. I heard that traditional versus Advantage is really the same cost, just the out-of-pocket is paid differently. Traditional, high monthly cost, Advantage, low monthly cost, but high deductibles when you get really sick, hospitalized. Is this true?
Yeah, it's kind of true. I mean, you're always, you're not paying for your Part A usually. You are paying for your Part B, and you have to pay for that both for original Medicare and any Medicare Advantage plan. But then with an original Medicare, you will probably want to get a supplement, and that's where your costs are high. But these are your upfront costs. What happens with a Medicare Advantage plan is that your upfront costs are much less. Your premiums would be much less, but there are these out-of-pocket costs, and you don't know how much they're going to be, because it depends if you go into the hospital, it depends for how long, it depends on whether or not you have to go out of network because you have some sort of condition where you need to see a specialist, and that specialist isn't in the network. So you just don't quite know what your costs are going to be with Medicare Advantage. The other thing is Medicare Advantage has a number of co-pays that I really urge you to go on to the website, medicare.gov website, and look at each plan, because there are a number of co-pays. For example, if you get, if you go for radiation or whatever, there are just a number of things that you just aren't even aware of that you're going to have to pay for. So there are all these additional costs, as I say, that they're not upfront costs, but they are costs that you will have to pay if you end up getting sick.
Next question. We currently have the G plan. How would we change it if we wanted to switch?
Basically, all you have to do, if you're getting the G plan from a particular company and you want to get a different plan from the same company, just call them up and tell them that you want to change your plan. If you want to go to a different company, I would first get your new plan and then drop your old plan. But you have to do it all by telephone. You can't do it on the Medicare website.
I see a question that I can answer. Will the recording be made available afterwards? Yes. All of our HealthyU webinars will be on our website, matherhospital.org/HealthyU. Is Plan F available if you have not gotten Part B? I have had Medicare Part A for 6 years.
No, it's not. You need to have Part B as well. So the fact that you don't have Part B, I'm guessing you're still working. So you need to have Part B. I guess you would want to do that after you retire.
Someone asked, can you email us the tables and contact info from the PowerPoint? If anybody would like the PowerPoint sent to them, please email us at matherhospital@northwell.edu so we can forward you. We will be sending follow-up handouts that Lynn has asked us to send to you, but if you actually want the PowerPoint specifically, email us at matherhospital@northwell.edu so we have the correct name and email associated with you through the Zoom call. Next question. My birthday is February 1st. I will be 65. My understanding is that I would be eligible for coverage on January 1st. Is this correct?
Yes, it is.
I have employee health. Do I need Part D when I sign up for Medicare since it's covered under my employer health plan?
Let's see. It would depend on what it is. It needs to be creditable, a creditable health plan. So you would need to check with your human resources department to make sure that it's considered to be, it's a term that Medicare uses, creditable health. So you don't always have to sign up for the Part D plan, but you just want to make sure that the plan that you would be getting is creditable.
My employer offers Blue Cross Blue Shield Medicare all in one. Is this better than having them separate? Medicare as primary, Blue Cross Blue Shield as secondary?
So I'm not sure what you're asking. Could you repeat it again?
Yeah, my employer offers Blue Cross Blue Shield Medicare all in one. Is this better than having them separate? And separate meaning Medicare is primary, Blue Cross Blue Shield is secondary.
If Medicare is primary, that would mean that you would have Part A and Part B, and you could use your employer insurance as your supplement. That's often done. I don't know, I guess I can't answer your question. I don't exactly understand what you mean by separate. So I'm gonna have to, maybe you can explain it a little bit more, and I can try and get back to you. Sorry, I'm not sure I can answer it.
You mentioned that you can buy supplement at any time, but do you have to buy a supplement? Do most people buy a supplement? I don't know that now. I have co-pays and deductibles now and just pay them out of pocket.
Most of the people I've talked to have bought a supplement because those co-pays out of pocket can really add up. So, but it's not required that you get a supplement. When I say buy a supplement, what I mean is you enroll in a particular supplement plan, and then you would have to pay a monthly premium. So that's what I mean by buy a supplement.
I'm turning 65 in January. I'm still working and have health insurance through work. When would I need to sign up for Medicare A, B, C, and D for prescriptions?
So did I hear you said that the person is turning 55 or 60?
65, 65.
And sorry, in January?
Yep.
So I would say in, let's see, October, November, December, maybe November, you would start signing up for things, and then your everything would start kicking in on January 1. If your birthday is in January, you would want to sign up for Part A and did you say the person's working? Sorry.
Yes, still working and has health insurance.
And has health insurance. Now, if you're still working, it depends on the size of the company that you're working in. So if you are working in a company, you're over the age of 65 and you're working in a company that has fewer than 20 employees or 20 employees or less, then you should get your Part B. But if you're working in a larger company that has more than 20 employees, then you don't need to get Part B, and you can wait until you retire to get Part B. So, so you should sign up for Part A because it probably is not going to cost you anything because those premiums are free, but you can wait to sign up for Part B once you are no longer receiving insurance from your employer.
I am single, 68, still working, have Part A only, fully covered by employer, will retire in December. When do I file for Part B? My work insurance still covers me after retirement.
It would cover you after retirement, but the question is whether it would be considered your primary insurer or your secondary insurer, and you have to check with your human resources department or your employer to find that out. If it's considered to be your primary insurer, then you don't need to get Part B, but that's rare. So you want to just make sure. And if it's your secondary insurer, then you need to have Part B because the insurance from your employer will not kick in until Medicare Part B kicks in. Now, when you should do it before the month of your birthday. So either 1 or 2 months before that, get everything lined up beforehand, okay?
How do I change drug plans?
Well, first of all, when you can change a drug plan is during open enrollment, which is coming up. So that's October 15th to December 7th. And you basically sign up for another drug plan. You can do that online, www.medicare.gov. And then once you've done that, you would just confirm with you. It may happen automatically, but I would confirm with your current drug plan that you're dropping it. I think that it would probably drop automatically, but I would confirm it anyway. But to sign up for a new drug plan, have to do it during open enrollment, and you can do it online, or you could call the company as well if you feel more comfortable doing that.
And one more question. My employer will pay for Medicare Advantage. What else do I need to be protected from high unknown costs you alluded to?
Well, you should read, I don't know if your employer is giving you a lot of choices as to which Medicare Advantage plan. Sometimes they only give one or two, or maybe only one. So you want to make sure that the Medicare Advantage plan that they're paying for is going to, you just want to know what it will cover, and the doctors that are in its network, and all of the different co-pays and coinsurance that you're going to have to pay. So that's really the only thing you can do besides deciding to turn it down and go with original Medicare. But then you're going to have those kinds of costs as well.
Somebody had asked to repeat the information for the recording. So you'll be able to access the recording on matherhospital.org/HealthyU. If you want the presentation sent to you, please email us at matherhospital@northwell.edu. And if you have any further questions, please email us at matherhospital@northwell.edu, and we'll reach out to Lynn to have her answer those questions for you. Just want to thank you, Lynn. The presentation was excellent, and obviously many questions because there's a lot that goes into this. I just want to let everyone know we're so grateful for you logging in for a webinar. Once you exit the webinar, you'll see a link that pops up to complete a survey. It's very short, and your feedback is extremely important to us. So if you could please fill that out, we would appreciate it. Thank you again for attending Mather Hospital's HealthyU webinar series on navigating Medicare. Thank you, Lynn.
Thank you. Bye, everyone.